Transmission, pathogenic significance, and symptoms of trichuriasis or whipworm infection in man. Transmission of trichuriasis or whipworm in humans, particularly in small children, occurs due to the eating soil-contaminated food and water through the fecal-oral route. It is noted that trichuriasis is the third most common soil-transmitted roundworm infection in humans. Globally, an estimated 800 million people are infected. The infection is mostly seen in many tropical and subtropical countries of the world. The whipworm infection in man is mostly asymptomatic. Symptomatic infection more commonly occurs in young children in case of heavy infection. It causes catarrhal or hemorrhagic trichitis and colitis. How does this pathogenic condition happen? I have already discussed. Symptoms include bloody diarrhea, rectal prolapse, abdominal pain, nausea, vomition, weight loss, retardation of growth, etc. Moreover, growth retardation and anemia are characteristic features of TDS or Trichuriasis Dysentery Syndrome.